Shirsagar, you can just stand up, please. He was telling me yesterday that in US, they tell us, you don't have medicines, you don't have panchakarma. How will you practice Ayurveda there? I think that's the crux, that's the strength of Ayurveda. Swasthavritta is strength of Ayurveda, prevention is strength of Ayurveda, promotion is strength of Ayurveda, for which you don't need necessarily formulations, products and industry and any interventions here. Simple remedies. Your health in your own hands. What Dr. Sharija ji was telling me, all of us, that ultimately public, what public is going to benefit. If you are able to really bring these strengths of Ayurveda on forefront, because today's problems are not which were faced 20 years ago. Today's problems are more psychological. So lifestyle medicine, behavioral medicine, mind-body medicine, all these terms, salutogenesis, Dr. Baghel ji was talking about, these terms are being used by Westerners, and actually they're using Ayurveda without bringing Ayurveda on forefront. So as a country, how we create this environment to understand what is happening globally, put our strengths on table and do something which will be useful for our country as well as for the whole world. So this non-pharmacological kind of a strength of Ayurveda also needs to be kept in discussion when we are talking about, because many times I have seen that discussions go on products and medicines and formulations and quality control, standardization and controversies about plants, whether this is right or that is right. So this was my point, Girish. So I have taken just 5 minutes and I think we will now request our...
Sir, अगर आप
just
करें तो 2 मिनट में अपनी बात रखना चाहता हूँ. Thanks for all seniors for your kind direction and suggestion. और आपने अपने मैडम ने जो दिल की बात कही, एडवाइजर साहब ने जो बताया, वास्तव में हकीकत है कि आयुर्वेद सारी दुनिया में आयुर्वेद की तरफ देख रही है. अल्टरनेटिव जो मेडिसिन है वो कल के लिए कोर मेडिसिन बनने जा रही है. लेकिन सबसे बड़ा क्वेश्चन जो है कि आयुर्वेद में सर्च और रिसर्च वाली बात है कि रिसर्च माने सर्चिंग ऑफ ओल्ड फैक्ट थ्रू मॉडर्न माइथोलॉजी. अगर फॉरेन कंट्री के लिए बात करें तो अगर हमने जो आयुर्वेद की आत्मा है, जो कि चरक ने कहा है, विद्या वितर्क विज्ञानम स्मृति तत्परता क्रिया षड्गुणा महते ना असाध्यम ना अति वर्तते. तो आयुर्वेद में रिसर्च के लिए आयुर्वेद की आत्मा अगर लग जाएगी तो आउटकम आने लगेंगे. आउटकम आने लगेंगे तो फंडिंग प्रॉब्लम नहीं है. आज प्राइवेट में अगर जैसे डाबर की बात करें या किसी भी इंडस्ट्री की बात करें तो वो पैसा तब लगाता है जबकि उसको आउटकम के लिए एश्योरेंस होता है. और एश्योरेंस करने के लिए एक प्रॉपर रोड मैप होता है, एक मॉडल होता है, एक तरीका होता है, जिसको कहें कि एक मेथड एंड मटेरियल. तो हमारे यहाँ क्या है कि गवर्नमेंट पिछले मैं अगर 10-15 साल का रिव्यू कर रहा हूँ, देख रहा हूँ कि काम में कमी नहीं है, सिलेक्शन में कमी नहीं. जैसे मैडम ने कहा कि अच्छी चीज़ों को स्क्रीनिंग करना चाहिए, स्क्रीनिंग डिपार्टमेंट में हो रही है, प्रोजेक्ट पे फंड लगातार दिया जा रहा है. बस प्रॉब्लम क्या है कि सिस्टम डिसेंट्रलाइज है, सेंट्रलाइज नहीं है. उसकी मॉनिटरिंग कौन क्या कर रहा है ये किसी को पता नहीं है. जैसे किसी भी ऑर्गेनाइजेशन को हमने एक प्रोजेक्ट दे दिया तो वो अपना कन्विंस देखता है कि मैं आसानी से कैसे पैसा उठाऊं, कैसे उसको लिख के जल्दी जल्दी सबमिट कर दूं और ओके करा लूँ. तो उसको क्या है कि अगर 5 टेस्ट करने हैं और उसके पास 2 टेस्ट की फिजिबिलिटी है, कॉम्पिटेंसी है, तो वो 1 या 2 में ही अपने गाइड को संतुष्ट करके काम को क्लोज कर देता है. जबकि हमने ये देखना है कि इंडिया के लिए नहीं, बाहर की इंटरनेशनल माइथोलॉजी क्या है. तो इसीलिए अगर बात आती है आयुर्वेद के, अगर कंसेप्ट की बात करें, विद्या माना कि वसा को जो है खांसी के लिए काम करती है कि नहीं करती है. तो इसके लिए पहले तो हमें एज ए आयुर्वेदिक फिजिशियन जानना जरूरी है कि विद्या, आज आयुर्वेद में सबसे बड़ी दिक्कत ये है कि हमारे आयुष के करीब 8 लाख के लगभग ग्रेजुएट होने जा रहे हैं, लेकिन उसमें से मुश्किल से 5% इस विद्या को समझते हैं कि बासा खांसी में काम करती है, सुदर्शन वटी से बुखार सही हो जाता है, वॉटेवर बहुत सारी बातें. लेकिन इसको जानना नहीं, मानना है. क्या हम अपने बच्चे को देने की कैपेबिलिटी रखते हैं? क्या हम अपने जो है घर में अपने माँ बाप को रस औषधियाँ खिलाने की कैपेबिलिटी रखते हैं? ये ऐसे क्वेश्चन हैं जिनके लिए आप जैसी जो पूरे इंडिया की क्रीम कह सकते हैं आयुर्वेद की, इसको सोचना पड़ेगा, इसका मंथन करना पड़ेगा. और मैं ये कहता हूँ कि हर इंस्टीट्यूट अगर साल में अगर एक प्रोडक्ट की स्टेबिलिटी डाटा प्रोड्यूस कर दे, वैलिडेशन डाटा प्रोड्यूस कर दे कि हाँ ये ड्रग सेफ है और इसकी स्टेबिलिटी मैंने कर दी, तो एक बहुत बड़ा अचीवमेंट ये फ्यूचर के लिए आयुर्वेदिक जगत के लिए होगा। इंडस्ट्री और एकेडमिया और इंस्टीट्यूशन और सरकार, ये सबकी अपनी अपनी लिमिटेशन है, सबकी अपनी अपनी स्ट्रेंथ है। गवर्नमेंट क्या है, लोगों को विजन दे सकती है, लोगों को गाइडेंस दे सकती है, लेकिन इम्प्लीमेंटेशन कौन करेगा? एकेडमिया करेगी। एकेडमिया क्या है कि हमारे अच्छे ग्रेजुएट पैदा करेंगे, लोगों को अच्छी अच्छी चीज़ें सिखाएंगे, लेकिन उसका अप्लाइड नॉलेज वो इंडस्ट्री कर सकती है। तो वी नीड टू जॉइंट हेड विद दी ऑल टुगेदर विद दी आयुर्वेदिक थॉट। जैसे आयुर्वेदिक थॉट क्या कहता है कि रोगी की मन आत्मा में जाके शास्त्र रूपी प्रकाश से उसमें अंदर उतर के चिकित्सा करनी है। अभी आपने कॉन्स्टिपेशन की बात करी, आप अगर देखें कि कॉन्स्टिपेशन में दवाई से ज़्यादा मेंटल स्ट्रेस का काम होता है, हाथों की पेरिस्टाल्टिक मूवमेंट का इससे काम होता है, वहाँ आयुर्वेद के सदव्रत काम में आएंगे। तो इसका मतलब ये है कि ड्रग रिसर्च भी उतनी ही इम्पोर्टेंट है जितनी कि हमारी सैद्धांतिक रिसर्च है। इसीलिए आयुर्वेद को एक ड्रग के रूप में ना देख के, जैसा कि मैडम ने कहा, ये एक सर्वांगीण सिस्टम है और इसको आयुर्वेद के रूप में अगर हम अपने आप को साबित कर पाएँ तो ये बहुत बड़ा चैलेंज है हम सबके लिए। और हमने कोशिश करनी है कि लोगों को लोगों की भाषा में बताएं, लेकिन हम अपनी चीज़ को भी इंटैक्ट रखें।
Thank you very much. We had another panelist, Dr. G.G. Gangadharan, who could not join us because of some personal emergency. But Dr. Gangadharan shares his thoughts that the most important challenge today is physicians' incapability of comprehending universal principles of Ayurveda. He also says further that material and clinical protocols, those are also needed for today's era to effectively implement Ayurvedic principles. With this, I request the chairperson for his concluding thoughts. Sir, our program is चलने दीजिए.
नहीं, वो इतना सारा सुनने के बाद मेरे पास भी विचार बहुत कम हो गए. Anyway, the responsibility, in the end is to sum up, actually, to look at the total picture. See, all the learned colleagues here on the dais, and actually the last concluding remarks were excellent from the audience also. No, I think that wisdom is, plenty of wisdom exists. There is no need of that. We lack wisdom. We don't understand what needs to be done, what has been done. But when you're thinking of a system for today, for the Ayurveda, environment, what environment? Environment means environment for vibrancy, environment for growth, environment for its best practice, its access to the people, which Madam highlighted from the very beginning, and then the evolution, actually, the science. Science for doing it better today, and science is for doing it for better tomorrow. I think these are 5-6 points, under which you can review what we have talked about so far in this very enlightening session, actually. Now, I was drawn into this entire business because of my job earlier in Delhi. Then I met people like Professor Patwardhan, then going through the planning commission, those discussion with the Secretary Ayush, Secretary Health, and then everybody, those stakeholders, who were really not trying to see mainly the access, the availability to the people. And and it's absolutely right, actually, what you think about why you should do something about. Well, India is a nation. We want to know our heritage, whether it's a historical, whether it's a history, economy, thinking, whatever, We want to know whether we have done something in medicine. And we have a system, not one system. Now there are a number of other systems which we talk about are the offshoots of the same basic system. They all interlinked to Ayurveda. So we have plenty. But then, today's context, when you think of what will you recommend to the people? And confidently recommend to the people. Confidently recommend in the policy also that this should be done, so that a number of parliamentarians, other people can surround the Prime Minister or the Minister concerned, Finance Minister, everybody, and to say that you push money into it. So that means you need to know make something which is useful to the people, large scale, which Madam Shailja Chandra was very nicely alluded to actually, which I think a number of other people also hinted on the same point. So that means we have a system at its branches or its other sister allied, not I say allied, the other systems which are linked to it, and they are acceptable to the masses. Now, when you say acceptable to masses, really do we have the data for that? How many people will go where? When I have some problem, or when a person of this stature has this problem, where he or she will go? So do we have such a data? So that means a need-based growth of the subject. So need-based growth of the Ayurveda. So that means there is a pure market, I tell you. If you want to survive today, many things have perished over a period of time. Anything can perish at any time, I tell you, because this is a competing environment. After independence also, we were in the same mindset of the British. We were just brown people, but the British, we are more British than the British. This is a fact, actually. So the truth is, when you want to implement something, I mean, what you want to market? Madam Chandra's point is very simple. There's 70% people, or this large number of people, maybe half of the people, don't have the paying capacity. And that every day we see, all of us see it actually. You see the suffering people, they don't have money in their pocket, they have nothing to eat actually, they have very little to eat, what to talk about the medicine? So they can't afford medicine actually. So you keep on creating some hospitals, symbolically keep on actually just doing the inaugurations of 5 beds, 10 beds, one machine, second machine, third machine. And the same thing we try to do with these Ayush systems also. It's more symbolic actually. Keep on doing one mela here, one mela there, one mela there. So in that, there are policies, but hardly anybody reads, hardly anybody implements. And next 5 years later, we come with a new policy. We forget about what has in the past. So that story, endless story continues. But intellectuals like this, like 100 people today, I think invited by Professor Patwardhan and his team, would do something. Something should be visible actually. Something should be known. And that has started happening like from this center actually. They'll be setting up the examples within the university, setting up the center within the Pune, setting up the centers working with the people in some other institutions. So examples have started happening. So that means when will you feel the impact of that? Much later, but that should not be ignored actually. So the individuals or the group of people like us sitting here, we can make a difference only when we focus on something, concrete ideas. Ideas may be right, ideas may be wrong. Ideas, are something about a very senior generation, like Professor Baghel has been there practicing that. He has taught to many people, many are his students. Many of the other people sitting here actually they are leaders in their own right today. Some is a DG, some is a professor. Like that, there are a series of other eminent professors sitting here, sitting on down in the audience also. So the first question starts a market, Do we really need to do what? For whom? So that means the systems has to be made access to the people. That is one point. What access for which disease? Number of diseases. Which one? Have you data on that? Something written in the Granth thousands of years back. Can you think that is today's truth? I think it's not that we are distrusting them. Charaka, Shushruta, all the people who have created those documents and their followers who have created them, they are honest people actually. I don't doubt their observations are wrong. But today's context, the populations have changed. The genetic pools have changed. Epigenetics is totally different. The diets are different, which are deciding, which is Dr. Manoj Nesri also talked about the effect of the diet on the microbiomes. And you have made a mess of that microbiome by introducing diets which were not there actually earlier, just for survival. Your own indigenous diets are gone. For a particular area, particular diets will suit. This is a known phenomenon. Our indigenous knowledge had really documented that actually. So that means those documents have a basis. But then you return to that document, you have to really publish again. You have to really show that today's evidence actually. Because when it will come to the policy making, the people will not say you're quoting something which is 3,000 years back. You quote that, but then you say, yes, today, so many patients have been seen in a different, like we made the recommendation for CCRS hospitals, thousands of patients are seen by them for a number of disorders across the institutions. And very few publications emerging out of that. because they don't have time to it. All the time they are being taken on like a herded on to inaugurate one mela here, one mela there, one mela there. And where is the time to write a paper actually? So the question is, limited number of people trying to do a lot of job, but that's not feasible actually. So to make a policy, there's no choice, I tell you. Now, how we do it actually, how we recommend, okay, some things are under control of one individual, set of individuals, some are collaborators of one place. Together, India still has a strength. Alone, you are totally useless, I tell you. 200, 300 people working in, scientists working in CCRS, they can make an impact if they are supported or they network with the other national institutions, they network with the old institutions like Jamnagar, Hyderabad institution, Chennai institution, Kerala institutions, which are doing still good science. So together they have a strength, alone they have nothing. So the first point, which you should start to build every time, just see that which network comes up actually. Its impact will not be there in 1 day or 2 days. But creating a stronger working networks on the diseases which you identify to be priority. And I tell you, I articulated, this is the third time I'm talking today. First I talked in Jaipur, I talked in one meeting in Delhi also. That prioritization is absolutely essential because you have to position yourself. You should be competing for the place where the other is totally a failure or a partial failure. There is cancer. The other party has a allopathy where you're competing with a mighty of money with it. Even, their eminent companies have paid to the textbook to introduce some regimens, and now they are caught actually. So those authors of the textbooks have paid heavy money by the very prominent American companies who are working and manufacturing anti-cancer drugs. So the companies are not saints actually. They promote science, they do good science. I'm not talking anything about Dr. Shastri and people like him are contributing to it. There are many other in the industry like that also. But otherwise the company research is money. And you need that money. There's no question. Without a commerce, nothing can happen actually. But they are not saints. They may not be foxes, all of them, but they are not saints. So the question arises today, once you work together, we have to sit together, then you make a priority, where the Ayurveda is required actually. Ayurveda for wellness, there's no question, it is required. Ayurveda for conditions like your mental health and other places, it is required, there's no question on that part. You must relive these actually experiences of today, collect them, jointly publish them to show that, this works like this. With these diets, with this kind of pattern, this is the success rate. And eminent clinicians, the good Ayurvedic institutions will give you a lot of data. You should have a data. CCRS institutions have a network. National institutions have a network. Good institutions have a network. So jointly publishing papers and just sharing the experiences on what you are recommending and what you are getting out of it. That's absolutely essential actually. Even for the chronic diseases like diabetes, hypertension. See, like I'm taking antihypertensive drugs for more like 32 years. Now, if I was taking some Ayurveda drug, like for example, the Serpacil in the old form, what would I have in my fate? I should know that actually. It may be better, Ayurvedic drug may be much better there, or maybe it may have some complications which are not documented. Any drug will have complications. There's nothing like absolutely safe. So I think anything which you take in a particular extra amount which is more than your normal life, this drug is going to have some effects actually. Some are tolerable, some are beneficial to you to a point, others are not actually. So you should have a data on that. So even today you should collect that data like the number of these on the psoriasis, on the musculoskeletal disorders, on the actually number of these chronic conditions where people are being treated by them. And somewhere the people are getting complementary treatment also at the same time. Maybe they're taking Ayurvedic drug also, they're taking an allopathy drug also at the same time. That data has to be collected to publish. And it's not difficult to find you actually. From your cases itself, you can publish that. In 3 years, 4 years, 5 years from now, you can have a lot of data on that. And that data for the preventive parts has to be linked to the public health, but Dr. Manoj Nisri very clearly highlighted actually. So there you have to show the population levels. And this is again not an impossible game anyway. See, the government could have done something for you. Government has done that actually. Maybe government didn't have much money. Government didn't have much faith and also you knew there's a truth also. Government symbolically and for the political reasons, government had to say Ayush. Some of the people in the government did believe in, some politicians did believe in that also. But not all of them. They had to do it because it was a popular. They had to, but the deep in the right mind, they may not be your supporters. So you have to show data there actually. You have to publish that. It is not questioning the old Sahita, it is not questioning the old knowledge, but it is, in today's context, you need to have the publications on all of them. If it doesn't come in a big journal, let it be something to be done by a CCRS, ministry, or even a groups like this actually. It's a joint publication. So it's a sharing of data and publication. So I think that's very, very critical actually. Then for the chronic diseases, where there are nothing there to offer on that side. Degenerative disorders, chronic kidney disease, polycystic ovarian syndrome, like a macular degeneration talked by madam. So there have been a number of huge lists, like Duchenne dystrophy, all the muscular dystrophies actually. There's a total back and out from that side actually. And they will take a number of years to come to a point actually. Cancer also at different stages. Cancer, there is both all are complementary. We may be primary, they could be secondary. They could be primary, we could be secondary. Or both could be equal partners. So, these are the number of challenges, which is a number of the chronic conditions. There is a back end space. And we have an ancient wisdom and a number of experienced people also here, where to position yourself. And that publication should come in a very, very short run, not waiting for years together. Because, all of us are interested. We know there is a truth, that there is Ayurveda is a solid science. And at the same time, we have a problem that it is not widely accepted. Because over the years, many things have happened. You can't reverse it overnight. But you can make a change much, much faster if you document, if you analyze, and if you publish. Doing the trials, comparing them for a new indications or a new set of indications, that's absolutely fine for future development, which should be done. Maybe from product development point of view, or making a new regimens for that also, you should be doing. That kind of work should continue. But even harnessing on what we have today, that's where we are competing actually, because we are not doing the right thing. So I think if you look from the top, right, the priority setting part, that which things to be focused on. At least, madam was saying perhaps saying 5, but I think at least a dozen things are very important for the Ayurveda. And these all chronic and degenerative disorders, right up to, like on the TDU is starting up a big program on the Parkinson's disease they already have. So Parkinson's disease, your neural degeneration, several problems, your liver degeneration, chronic kidney disease. There's a number of, and there are number of people who are suffering in crores actually, not in thousands even. Like chronic kidney disease, the people who keep on languishing, and if you prevent and delay their dialysis or renal transplant for 10 years, it's a big thing actually. So I think, that way we really have to focus on sit together and really do the deliberations on which area to be focused on and how to collect that data, which people are already doing. Many people are coming to you. Because what we need to do actually. Government has done the institutions. Government has actually even co-located you. Now, if you're co-located, but the other fellow doesn't know the name of other fellow, okay? And you don't know if the person is coming to you, what will you say? Well, does my disease works this far?